Welcome to Home Care, Doors Open, where we discuss licensing, operations, and scaling your home care business. Whether you're just opening your doors or looking to unlock new doors to growth and success, this podcast is for you. Let's begin.
All right, hello everybody and welcome. This is Lucas Carroll from the Business of Senior Care, and we have a guest today on our podcast, Home Care Doors Open, and I'm super excited to have on our podcast Teresa Harbour, who is the COO of CHAP. Welcome aboard.
Thank you. Great to be here.
Yeah. I'm excited to get into some topics around accreditation and CHAP specifically, but to start, would you mind just telling us about what your role as COO is at CHAP and a little bit about CHAP as an organization?
I would be happy to. So I'll start off with myself. I'm a registered nurse by training. I started, like most nurses do, working in a hospital. That was just not for me. So I stayed there right out a year, then left and went to our local hospice and just completely fell in love with care in the home. There's just no better place to receive care or deliver care. And I've stayed either doing hospice or home health really ever since. So for about 35 years, I've worked in this field and been at CHAP now for just a little over 5 years. I've been with another accreditor for 14 years prior to coming to CHAP. I've always been one of those people that love care in the home, but also regulations, quality. And so being at CHAP has been a perfect fit for me. So just to tell you a little bit about CHAP. CHAP started back in 1965. It was a joint venture between the American Public Health Association and the National League for Nursing. They had actually identified a gap. There was no accreditation organizations that were focused on home and community-based organizations. So we were formed. We were the first to be approved by CMS and have deeming authority for home health and hospice. And since then, we've added other programs as well. Other deeming programs, but also non-deeming programs like home care, palliative care, pharmacy, those type of programs. CHAP it continues to only focus on home and community-based care. We've not ventured into hospitals and do not see that happening because we're very passionate about care in the home.
Very good. Well, thank you for that introduction. I was thinking for some of our audience members, they may be, thinking about getting into this space for home-based care as an agency, and they don't have a lot of experience kind of in this industry. For those folks, just kind of laying the foundation, what is accreditation? How does that weave into somebody who's looking to start and grow an agency? When does that come into play? So just so we can all learn a little bit.
Okay. Well, I'll focus a lot on home health and hospice because those are deeming programs. I will talk a little bit about home care, but I'll start with home health and hospice. So if you are a hospice or home health or individual thinking they want to start at home health or hospice, you do typically need to go through an accrediting organization if you want to have to be able to get your Medicare provider number timely. So right now, if you're looking at going through a state agency for to receive your Medicare number, that's on like a tier 4 for state agencies. So it takes them a very long time. It's kind of when they can get there, that they'll do that type of certification survey. So most agencies choose to go within an accrediting body. Like I said before, we do have deeming authority from CMS for both home health and hospice. There's lots of other things you have to have in place, though, when you're looking at starting a home health or hospice. So if your state requires licensure, you definitely have to have a license in that state before you can start taking patients. The first step would really be, working on your state license. You'll have to submit an 855 as an application to your MAC, your Medicare administrative contractor. To start that process for Medicare certification. So you'd submit that. You would start working with an accrediting organization because we have lots of resources available to help agencies. We have an accreditation specialist that's assigned by state to assist agencies, but we also have a director of accreditation that is a clinician that's also assigned to by state to particular agencies. So they're not only knowledgeable of federal requirements like the COPs, the conditions of participation, they're also knowledgeable of state requirements as well. So you would work with a accrediting organization when you have served your appropriate amount of patients, and CMS has certain requirements around that. So if you're a home health agency, you have to have served 10 skilled patients and have 7 skilled patients at time of survey. There's other requirements around that. You've got to provide skilled nursing services. You also have to have another therapeutic service, whether that's PT, OT, ST, social work, or aid services. So you have to be able to provide those 2 services. And then after you get everything ready, you've had your patients, you've got your approval letter back from the MAC, then we come out to do your survey. So that's on the home health. And of course, on the hospice side, there's some different requirements for that. You have to have serve 5 patients. You have to have 3 active patients. You've got to be able to provide all 4 levels of care. You've got to be able to provide all core services by W-2 employees. So there's other requirements as well. Of course, the license, the 855, those type of things. Once again, CHAP has a lot of really good readiness resources. We have a optional self-study that you can use. It's kind of like a workbook that you can go through and check off to make sure you're ready prior to us coming out. For home care, since it's not CMS regulated, you do have to adhere to state requirements. So if you have a licensure in your state, then once again, you have to be licensed by the state. Make sure you're following all of those regulations and requirements, and work with us to come out to do your state survey. In some states we can do, but if not, we'll do your home care accreditation survey. That just enables a home care organization to really ensure that they're providing that consistent, high quality care, even in those states that do not have licensure requirements.
Nice. Thank you for going through that. What I was thinking, oftentimes when we talk to clients when they get started with us, is that they think that accreditation is scary. You have to jump through all these hoops to going through accreditation. Can you speak to that a little bit about how, from a CHAP perspective, that you guys really get involved from a support system to help to make sure it's a successful accreditation experience?
Absolutely. So early in my career, I actually was a surveyor, and it always just completely mind-boggling to me because, as you can probably tell, I'm not a scary person. And but sometimes I would select, nurses to go out on home visits with, and they would be so upset. They would be in the bathroom, literally throwing up. They were so nervous because I picked them to go on a home visit with. And I'm like, just get them out of the bathroom, let them meet me. They'll be fine. But yes, you're right. Agencies get a little stressed over surveys. And I definitely understand why. Because, a lot of agencies are, independently, owned. They are, they've started this company themselves. They've taken second mortgages out of their homes to do this, and they have a lot riding on this, so it is stressful. So we really work with agencies to make it as stress-free as possible. But just somebody coming in is going to be a little nerve-wracking. But I'll tell you what I hear from customers and what I see from satisfaction surveys that come back to CHAP is that our surveyors, we call them site visitors, just really put them at ease. They were very stressed. Then they start talking to the site visitor, and their stress just really decreased. They were very engaging with the staff. They were not interrogating the staff. They were just asking questions, talking about the care that's being delivered, going through the patient records with the staff members. And it really was a positive, learning, collaborative experience. And those are those words that I typically see on these satisfaction surveys come through. But yeah, I think too, having that person that they can call that is, their director of accreditation, that's a clinician, that they can ask questions of, I see this standard, what exactly does that mean? And having that, person that they can go to, that is their person, that they can have those questions answered. So I think that is something that then they kind of know, not that this person is going to be their surveyor or their site visitor, but they know that they have that person they can reach out to during that site visit if they have any concerns or questions. Just having that person has your back during the survey, I think, has been very helpful to once again to decrease that stress. All of our site visitors, they're all registered nurses, all at least bachelor's prepared, all have been in this business for many, many years. So they're either home health nurses that are doing the home health surveys, they're hospice nurses that's doing the hospice, or if they're doing home care, the non-Medicare certified home care agencies, and those are also registered nurses that has worked in home care organizations. So it's very much peer to peer. And I think, once again, that decreases that stress as well. So we do try to make it as stress-free. And I think, just being able to get to know the AO, the accrediting organization, helps a lot. I think it's funny because I'll have an agency to say, oh, I didn't want to ask this question because I didn't want, you to think anything negative about me. I'm like, yeah, we don't take notes. We don't say, oh, so-and-so called in with this question. I need to tell the site visitor to make sure they look at that when they go. I mean, we don't do that. I mean, we are here to support our agencies because at the end of the day, our mission is very much like the mission of the home and community-based organizations that we accredit, and that is to ensure high quality care is being delivered.
Absolutely. And I think to that point right at the end there, what we often hear is like the value add of an accreditation organization. And I want to hear your perspective on that. But I think what we see is that there's one thing to get the state license and read through the regulations and have a policy manual and do agency to do their best to adhere to those things. It raises what we've seen is it raises to a whole new level once you are going through the accreditation process, because that the survey is coming, and you want to make sure that you understand the state regs, the accreditation standards, the COPs. You want to make sure that you understand that as an agency and that you're doing it from the very first patient, that you're doing it properly and doing it the same way and documenting every time the right way. And I think that the value is so much there because that there is the accreditation survey that's coming that's going to be looking at and reviewing and helping you as an agency to make sure that you're doing it correctly, because it's a hands-on application. We see our owners, agency owners, that get actively involved and they really dive in to understand the regulations and accreditation standards so that they can do it correctly, they can document appropriately, they can track their patients the right way, so that when it comes time for survey, it's a much better process. So that's what we've seen, but I'm curious for you, some of the value adds of going through accreditation.
Well, I think you really hit a lot of them. It is that consistency. It is, it's really ensuring that high quality, ongoing compliance is being maintained. And that is definitely something that CHAP supports our agencies through. During on-site visits, the site visitors, they see agencies all across the United States. And so this is a great opportunity for them to share. Now, they would never share anything proprietary, but share best practices. If they are, the agency struggling in this particular area, given some, great ideas of what they've seen work well at other agencies. And so I always tell agencies, you're paying for this site visit. Tap into the resource that you have in front of you. This clinician has, a lot of our site visitors have been around for the very seasoned, I should say. They've been with us for quite some time, but they've also worked in agencies for many, many years and have held leadership positions in home health hospices, home care organizations. And so they not only are pulling from their background of their day-to-day work in that organization, but they also have been with CHAP for many years and, like I said, have seen best practices across the nation. So tap into that person. Don't be one of those individuals that doesn't want to talk, doesn't want to engage with the site visitor. It is a wonderful learning opportunity. So I think that provides a lot of value and also provides just a lot of really validation that we're doing the right thing. Because like you said, there's so many regulations. There's state regulations. There's federal COPs that you have to adhere to. Our standards very much mirror the COPs. And We incorporate the regulation of the COP into our standards so that we're not very prescriptive. So, we always tell agencies to make sure you follow the COPs because that's the most important thing. And that is what our standards very much follows as well. Because at the end of the day, we want, once again, to see that high quality, safe, patient care is being delivered. So I think that, making sure that agencies, have that consistent practice in place is one of the great values that accreditation brings. But also, as I mentioned before, using us as a resource. If a state regulation is changing that you don't quite understand, or there's a new COP that's came out, or a new, CMS requirement that's came out, having, that director of accreditation that they can reach out to. Or we've even looped in our VP of Quality and Regulatory, Jennifer Kennedy. She was with NHBCO for many years prior to coming to CHAP. Very knowledgeable in quality, and if there's an issue that we've had agencies that have been working on, maybe it's hospitalizations. I'll just throw that out there. That's typically a problem for many of our organizations. Pulling Jennifer in to kind of just talk through and give some best practices on some of the ways that they can, target some of those quality initiatives. You once again, using us as that resource, you do have that when you go through CHAP accreditation.
Nice.
Just being able to pick up the phone and call not only your director of accreditation, but if there's something that we're seeing at a federal level that you are wanting additional guidance on, having Kim Speehan, our VP of accreditation, available to jump on the phone call. I think just that lot of support that's provided throughout that 3 years. I tell agencies, don't just use us to come out to do your accreditation survey. We are here to partner with you throughout that 3 years. So I think being able to tap into that is a huge value add. Not only that, and some of our standards that are focused around quality to ensure quality practices, safe practices in regards to patient care are in place, and you definitely pick that up through our standards. And being able to demonstrate to us how you're meeting the intent of the regulation or the standard versus us telling you this is how you have to do it.
Absolutely. And I've experienced that from our clients too. Like, just reach out and ask. Like, if you're unclear on what the standard is, the intent of it, and whether you're in compliance, don't guess. I mean, these are the team members that you need before you get into an actual state survey, or before there's something that comes up with Medicare or something like that. Like, this is your team to be able to ask, like, hey, I just need clarification to make sure that we're doing it correctly. So that you can continue to improve as an agency. So I totally agree with that. The last sort of question I was thinking of was a little bit broader, and just kind of what the future will hold. I know you have years of experience in the home-based care, and you've seen agencies all over the country. I'm curious on your perspective, moving forward, what home-based care is going to look like, an increase in agencies, how that delivery will look like as our boomer population continues to age. What do you think that's going to look like in the next few years?
Well, we're definitely getting older, and our patient population is getting older, and we want to stay at home. We want to be cared for in our homes. We want to make sure that we've got the services available, and we know that when care is delivered in a home, you have better outcomes. You're happier when you're at home, in your home setting, right with your family. So, I think that, home-based care is only going to continue to rise. I know that we're looking at ways, and we can support organizations and, patients to make sure that they have what they need to stay at home. We're just rolling out our high acuity care at home certification. So looking at more of those hospital at home type waiver programs, or those programs that prevent hospitalization, how we can work with those organizations to ensure, once again, standardization of practices, best practices, high quality care for those high acuity patients that are not your typical home health patient. They are hospital type patients that you're being cared for in the home. So I think that we'll see more of that. I think that you'll go back to seeing, and we're already seeing this a lot, is more of those doctors making house calls. Back in the day, then that's what doctors did. We'll see more of that. And we are, like I said, already seeing a lot of that already. Keeping patients at home where they need to be, where they want to be, and being able to have access to the care that they need at home. So, I think that we'll only see that grow. Now, of course, we all know there's reimbursement issues that's tied to that. I think we're going to have to get creative with that as well, and look at opportunities for what can we do through telehealth, what can we do virtually that doesn't maybe require a home visit.
Yep.
So I think that those opportunities they are there, but I don't ever see care in the home going away.
Yeah, I would agree. I'm excited, more excited about home-based care, just with the trajectory of, just like you're saying, just people wanting to be at home. They're happier at home. They thrive at home, and the focus model changing to clinicians and practitioners coming to the home rather than the person having to go to the hospital or go to a facility or something like that. So I agree. Future looks bright for home-based care. I agree with that. Well, good. Well, awesome. Teresa, thank you so much for the opportunity to come on and share your wisdom and experience with our audience. I greatly appreciate it.
Oh, absolutely. Anytime that we can support you or any of your customers, just let us know. And, happy to have our partnership as well. And, your customers get a discount off CHAP accreditation. So
And
make sure you remind them of that.
Yes, we're very thankful for that. Absolutely. Well, again, we're joined by Teresa Harbour, the COO of CHAP, and just very delighted to have you on here today. And thank you very much for your time.
Thank you.
If you found this conversation valuable, please leave a review on your favorite podcast platform. Also, be sure to like, comment, and subscribe to our YouTube channel, The Business of Senior Care. We'll see you next time on Home Care. Doors open.